Hey, it's Miss H. As you know, today we are going to learn about fibroadenoma of breast. What is fibroadenoma of breast? Fibroadenoma is a benign or non-cancerous breast tumor. Over time, a fibroadenoma may grow in size or even shrink and disappear. It's typically round or oval shaped and a rubbery feeling as well as painless. When you touch it, it's easy to move around under the skin as opposed to being stuck in one place. The discovery for fibroadenoma of breast. First, they are very small. Most are only 1 or 2 centimeters in size. Next, it occurs in women, commonly in younger or pre-menopausal women. For your information, the tumor consists of breast tissue and stromal or connective tissue. Fibroadenoma can occur in one or both breasts.
Next, the pathology of breast fibroadenoma. Higher estrogen levels due to pregnancy or hormone therapy or hormone disorder will stimulate the growth of stromal and epithelial cells. These cells have hormone receptors for estrogen hormone. Abnormal higher level of estrogen will cause excessive proliferation and cause fibroadenoma.
Hi, I'm Anna. I have been noticed the lump in my breast lately. So I went to meet a doctor and...
Fibroadenomas are the most common lumps found in adolescent girls. They usually occur under the influence of hormonal changes that the girls undergo at the time of puberty. They usually present as simple, mobile, painless, smooth, well-defined lumps. They can be present in one breast or in both the breasts. They could be single or they could be multiple also. Majority of the times they remain stable in size. They do not really increase or decrease. However, a few may even reduce over time once the hormonal influences wear off.
Hi everyone, today I'll present to you on how fibroadenoma will be diagnosed. There are 4 types of diagnosing fibroadenoma. Firstly, it is diagnostic mammography. Mammography uses X-ray to produce an image, which is mammogram. Mammogram shows suspicious area in patient's breast tissue. Fibroadenoma high appear on a mammogram as a breast mass with smooth round edge distinct from surrounding of breast tissue. Secondly, the method of diagnosing fibroadenoma is breast ultrasound. If a mammogram indicates that she has a breast lump or other abnormality, a breast ultrasound might be used for further assess of the lump. A breast ultrasound can help to determine whether a breast lump is solid or filled with fluid. A solid mass is more likely a fibroadenoma. A fluid-filled mass is more likely a cyst. Usually, if the patient is 20 years old or younger, she will be diagnosed with these 2 types of method. If the patient is under 40 years old, she is more likely to have an ultrasound than mammogram method. However, for some women under 40 years old, this mammogram procedure still need to be done to complete the assessment. Next, it is fine needle aspiration method. This procedure uses a thin needle that will be inserted into patient's breast. Then, this method will attempt to withdraw the content of the breast lump. If fluids come up, the lump is more likely to be a cyst. Lastly, to diagnose fibroadenoma, core needle biopsy method will be performed. A radiologist will perform this procedure with the guidance of ultrasound result. This method uses a needle to collect tissue samples from the lump. The samples will go to the lab for analysis.
Gross appearance of fibroadenoma of the breast. The mass is small and well encapsulated. The mass is a spherical and discoid mass. The cut surface is firm, grey-white and shows slit-like spaces. Normal histology of the breast. This image shows the normal stroma and glands of the breast. The breast is composed of secretory lobes embedded in adipose tissue. Intralobular stroma consists of loose connective tissue, fibroblasts, and scattered lymphocytes. Interlobular stroma consists of dense fibrous tissue and adipose tissue. Each of these lobes is a compound tubular acini gland. The acini empty into ducts that are lined by cuboidal or low columnar epithelial cells and surrounded by myoepithelial cells. Fibroadenoma is observed under low magnification, in which the entire lobular tissue proliferates. Fibroadenoma is viewed under higher magnification. Proliferation of both glandular elements and loose connective tissue stroma of the lobule can be observed. Under higher magnification, within the lobules, the proliferation of loose connective tissue has compressed some of the glandular acini or ducts to form elongated thin tubules. This is known as the intracanaliculair fibroadenoma. In other areas, the proliferation of loose connective tissue has not compressed the glandular acini or ducts. This is known as the pericanalicular fibroadenoma. It is not unusual for both patterns to be seen in one lesion. The loose connective tissue stroma containing glandular structures are separated by the dense collagenous fibrous tissue. This is image under higher magnification showing proliferated stroma forming elongated thin tubules known as the intracanalicular fibroadenoma. Examination under higher magnification showing formation of new blood vessels known as angiogenesis. Scattered red blood cells due to ruptured blood vessels known as hemorrhage. Microscopic view of higher magnification shows abnormality can be seen in which the angiogenesis is forming inside the glands.
Today, we will discuss on treatments and prevention. As you know, treatment of fibroadenoma may not necessary unless they are large, painful, or cosmetically undesirable, in which case they can be removed. Treatments for fibroadenoma of breast. The first treatment is watchful waiting. Fibroadenoma may be left and monitored for growth. Cryoablation. It's destroying the lumps by freezing them without removing them. And the last treatment is by excision. It's cutting out fibroadenoma with scalpel or traditional excision. Fibroadenoma of breast preventions. The first prevention is to get routine self-examination of breast. It's more important if there is a positive family history. The second one is to consume more fruits and vegetables. And the last prevention is have daily exercise.